Nursing homes don't have the staff to put that kind of time. I mean, some of the patients I've had to change dressings and do different procedures on their wound care daily can take up to 2 hours. By the time you get into that room, you clean them, or you move everything and put it back up. So that's a lot of time to be stuck in a room and not be able to leave.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I'll be your host for this episode. Although nursing home appears in the title of the show, today we are talking about LTACs, or long-term acute care facilities, how the medical care is different in that type of facility versus your typical nursing home. But we're certainly not doing that alone. We have the fantastic Melissa Pickett on the show to walk us through that process. But right now, it's time for the nursing home regulation question of the week and your opportunity to win the Nursing Home Abuse Podcast coffee mug. Great for sipping hot coffee or being on your shelf, and you put your pens and coins and buttons and whatever you want to. It's a fantastic container for anything, whatever you want to put in there. How do you win, you might ask? Well, it's very, very difficult. You go to TikTok. You find @JusticeForResidents, which is our TikTok handle. You're going to look for the question of the week thumbnail. For this particular question of the week, you're going to look for a bottle of blue cheese dressing. That's right. Looking for a bottle of blue cheese dressing. You're going to click on that thumbnail. You're going to comment your answer to the question of the week along with your favorite salad dressing. My favorite salad dressing has been blue cheese dressing since I was a little kid. I have the palate of an 85-year-old man. I remember my father used to take me to Wendy's every once in a while when they would have the super bar. If you're of a certain age and you enjoyed Wendy's, you know what I'm talking about. For maybe 3 or 4 years. And it wasn't very long, at least where I was. They had a salad bar at Wendy's. A salad bar. They called it a super bar. I was a child. I didn't want a hamburger and french fries. I wanted a salad with blue cheese on it, and I want to say they had baked potatoes on there as well. So I'd have a salad and baked potato. 85-year-old man when I was 9 years old. Okay? Anyway, you're going to comment your favorite salad dressing. We're going to pick a random winner. Again, no one ever enters this. This is getting ridiculous. I probably should just get rid of this section of the episode of the show itself. But anyway, if you want it, it's yours. Just reach out to us. We'll ship you this coffee mug wherever you are. Put some blue cheese dressing in it, whatever you want. Difficulty level this week on the question, folks, is easy. And I say that because Gene does an absolute terrible job of drafting these questions. I literally have to rewrite the question every time I go to record because I don't write the questions. Gene writes the questions. I read them. But typically they're awful and I have to rewrite them. But I'm not rewriting this because I don't feel like it. I got things I got to do today, so I'm not taking the time to rewrite the question. Literally, I'm going to read it as is. And as it is, to me, it's super easy. It's ridiculous. So good luck. Under 42 CFR 483.55, what must a nursing facility do if a resident asks for help getting to a dental appointment? Is it A, assist with the appointment and transportation, B, offer the facility's library as an alternative, or C, recommend watching an instructional video on dentures? That answer is A. Under the federal regulations, a nursing home is required to assist the resident in getting dental services, which includes transportation and scheduling, not making them watch instructional videos. That's what I'm saying. This was super easy. If you didn't get this, I don't know. I feel bad for you. All right, enough of the tomfoolery. It's time to get into the meat and potatoes of the episode. As I mentioned, we're talking about LTACs today. LTACs. But we're not doing that alone. We have Melissa Pickett on the show. Melissa Pickett, founder of Peaceful Views Consulting, is a legal nurse consultant with over 14 years of nursing experience in oncology, cardiac care, critical care, and infection control. Known for her integrity, compassion, and professionalism, Melissa brings clinical expertise and clear insight to complex medical legal cases. A lifelong learner and proud mother of three, she's dedicated to bridging the gap between medicine and law while helping attorneys navigate high stakes cases with clarity and confidence. And we're so happy to have her on. Melissa, welcome to the show.
Hi, Rob. How are you doing today?
I can't complain, rocking and rolling. So typically I like to try to start off the podcast interview with a softball question. And your softball question is basically, what is an LTAC?
Very good question. So a lot of people will confuse what an LTAC is because it can be layered in many avenues, meaning some of the LTACs have very specialty services that they offer. So a simple definition of an LTAC is a long-term acute care facility. So meaning that a patient that has been in a hospital for a very wide range of high need issues, medical issues. And they've kind of reached that limit where they can't stay at the hospital anymore, but they're definitely not ready to go to a nursing home, to go home, or anything like that. So they need to go somewhere where they can still be very closely monitored and allow constant nursing supervision so that if things start to waver again on their care or on their reaction to whatever their situation is, they're able to be quickly intervened upon. So what I mean by that would be, say a person was in a motorcycle accident, and so maybe they've healed enough and they're not critical enough to stay in an ICU or even a step down unit at a hospital because they've kind of reached their max days, which is a lot of times determined, by the insurance and things like that, that a long-term acute care becomes an important option because not only can they get everything they were receiving in those critical care areas, they will get additional services to kind of help them heal and get more ready for discharge to go home.
So essentially, I guess it kind of boils down to how what the acuity level is of that person. If they're high acuity but they need continuing care, they're going to discharge from a hospital and go to an LTAC rather than a rehab or a skilled nursing facility.
Correct. And again, depending on that acuity, there's different levels of that for different LTAC facilities. One facility that I used to work for, it was actually housed right in the hospital. So if you, for example, the patient coded and we couldn't keep the patient on the unit, it was really easy to get them to the ICU very quickly because we could get them back just like they were on the floor of a different level of the hospital, but they were receiving the care from the LTAC, not from the hospital directly.
Other than the staffing or the physicians available, etc., what are the interventions or what is the care that's provided at an LTAC that's not provided at a nursing home?
Right, excellent. So a lot of patients will be on ventilators, so they're still receiving, they're sustaining support through their breathing with those devices, and we're still in the process of weaning them. Um, they may not be very alert yet. That's not uncommon for them to come and still be really out of the environment, either sedated or just not able to truly arouse. Um, Extensive wound care that needs to be done and monitored pretty regularly, not just typical easy things, so wound backs and, really post-surgical complications, things like that. Also longer term or more frequent IV antibiotics that they may still need to require that a nursing home would not be able to perform, as well as just some sorts of levels of rehab that they'll be getting, PT and OT on top of that, but typically again still being kind of brittle in their recovery and needing those critical skills.
When you say like aggressive wound care, are we talking like burns or
It definitely can be. Yeah, it could be burns, it can be where dehiscence from surgery, where they have, wound vacs that need to be monitored really closely because again, that's, in great contact with the organs and things and internally can cause some damage if they're not monitored and applied appropriately. Um, but it's usually a combination of things. But wound care is big, especially if that patient's not able to go home, where they might be able to set up home care and things like that. But it's still a little bit more critical.
In a nursing home, the attending physician is in charge of the medical care that the resident receives, but they're typically only responsible for showing up at minimum once a month for the first 3 months, typically, and then basically once every 60 days, they're on out. That's the
Correct.
minimum of the attending physician in a nursing home. How does that compare to the physician's involvement in an LTAC?
Right. That's another huge critical change. Some of the facilities will have, a lot of them will have daily rounds. So it's just like, again, in the hospital where the nurses will go around and the charge nurse will go around and you have respiratory therapy all discussing what the status of the patient is. And again, with discharge in mind, because we want to get them to a point where they're ready to go and not have those surprises at the end. Um, so you're going to not just have the daily nursing supervision, but the doctors are usually on staff in site, able to address immediate concerns for at least part of the day.
I see. So, way more involvement with the attending physician, more similar to a hospital than a skilled nursing facility.
Exactly.
Okay, so we have a patient that's at a hospital that's in a grave condition, but as you mentioned, they can come out of the ICU. What are some of those, like, are there borderline cases like, hey, this person should go to an LTAC? No, 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 I want them to go to the nursing home. Like what's that kind of give and take about where they're going to go?
Right. So some of that's also, you know, the age of the patient as well, and kind of the, investment of what they want for their treatment, right? What their choices are for their next stages of life as well. But it can go both ways just to keep patients, but typically um, making that decision really falls on the insurance being able to provide support for the family, right? Because it's not a cheap option to have. So if it's not something that's covered, can become a big decision for the family as well. And then finding a facility close enough so the family can still be a part of that. Sometimes in, more areas that don't have as many LTACs, so not as, as populated of an area, that can become a huge barrier as well, because then the patient maybe have to be shipped further away and then family can't visit, and that becomes very difficult for them as well.
Speaking of that, what are some of the common misconceptions that you find the public has about LTACs with respect to, their difference between the LTAC in a hospital or an LTAC in a skilled nursing facility?
I think it's a lot what we just talked about as well is, they don't really understand because it's not something people really want to talk about. And it's not something we really know about unless you either had someone that is involved in having this type of care or you have a medical professional that can talk about these different things with you. So I think the education in the hospital by those teams, with preparing families and patients for what is to come, it is a huge step in that so that they have the opportunity to kind of investigate. And with all the tools that we have now online to look those things up, it's important to kind of take those options to at least get some general knowledge, so that you have questions to ask.
If insurance or payment is not an issue, is there typically going to be an instance in which you would say someone can, nah, don't go to the LTAC, you can just go to the nursing home? Wouldn't it be the LTAC 10 times out of 10?
Um, as long as they meet that criteria, right? Because we still would have criteria to meet to have to utilize the beds. There's also the availability, right? Are we getting enough people out? Because they do tend to stay pretty full. Um, so there are some variables there, but what I've seen for the most part, it's a financial reason that they don't come in, or it's a change of status where they just kind of want something, and it's not going to be under kind of the umbrella. Because typically a stay is like up to about 30 to 45 days. So it's what you're looking at when you're going there typically. Obviously, there's cases that leave a little sooner, but when you're expecting them there, they're going to have to stay for a minimum of 30 days is what you're looking at.
It typically or ever, is it the case that you have an individual that's in an LTAC forever? Like they're not going to be discharged from the LTAC?
The only way I would see that happening is if it was more of a private pay, and insurance would never allow you to be there forever. We either need to be doing metrics to get to certain steps so that we can move you to a different type of facility, if that's a nursing home or some other type of care facility that maybe you need. Um, but typically, no. I mean, there have been patients that I've seen there that are for months, but I wouldn't say for years. Because there's things that can happen too. Like I said, if the patient codes and needs to go back to the ICU, they could be coming back and forth quite a bit. Um, so, they tend to stay. But we do have to be showing, right, through our efforts that we're making progress. And if not, we need to be having those conversations of why that's not happening.
My understanding of like the nursing zeitgeist is only through TikTok. Okay. And it seems to me that like nursing homes as a nurse like gets a bad rap. Like, oh, I'm a nurse and I'm working at a nursing home, but I'm waiting to get a job at some other place, right? In kind of like that same idea, like where is the LTAC? I feel like the LTAC is kind of like almost like it's got it's got the stress of an ICU, but maybe the bummer of working at a nursing home. Does that make sense?
It does make sense. And it's not an easy place to work, and it is not for the faint of heart. I will be honest with you. It was probably one of the most difficult but rewarding jobs I've ever had. And not only because I was functioning a lot as a charge nurse or above in these roles. And so I not only had to help with patients, but also help with the staff, right? So I got to see a lot and how that affected them. And with having the patients there longer, kind of like a nursing home, you do get attached to the families and the patients a little bit more because you're spending a lot of time with them. And typically, when you come on and off shift, they have their favorites and they kind of want you back if they have bonded with you because they trust you and the patients trust you. And patients do better when they have caregivers, right, that trust them. So I think more to answer your question, it's probably looked at a little bit more respected because when people understand and see what a nurse is actually doing and managing, I mean, you are functioning at a pretty high level constantly. And even you're supporting, your medical assistants and all of the staff around you, it has to be a strong team in order to keep those patients safe and getting things they done every day. Um, because yeah, it's sad because and that's one thing I'm passionate about right now is looking at how we change that perspective of a nursing home, right? Because we have some wonderful people doing amazing work, and again with limited resources and very difficult situations.
I didn't ask you this, but is there like in terms of like medical equipment, like is there anything that's happening in the LTAC that absolutely does not happen in a nursing home?
Just about everything that can happen in an LTAC won't be, including patients that would get hemodialysis, because that could happen at the bedside depending on if they have, room set up for that, which is very nice for the patient because they're not leaving that space. The dialysis nurse is coming to them, performing that procedure. Again, ventilators and things like that. If you're weaning and actively trying to remove a patient from that, that's going to be something that stays completely in LTAC. IV antibiotics that need to be administered daily. That's very difficult for a nursing home to do. I wouldn't say it never happens, but I think it's pretty hard to get approved for happening because, again, your nurse ratio is quite different there, and a nurse would have to be overseeing an LPN or, administering them themselves. And even some of the extensive wound care because not, nursing homes don't have the staff to put that kind of time. I mean, some of the patients I've had to change dressings and do different procedures on their wound care daily can take up to 2 hours by the time you get into that room, you clean them, or you do move everything and put it back up. So that's a lot of time to be stuck in a room and not be able to leave, right? You have to have supporting staff to make sure all the patients are staying safe while you're kind of tucked away taking care of that.
Well, Melissa, very, very much appreciate you coming on the show and sharing your knowledge with us.
Thank you for having me. It's great to be here.
Great. Folks, I hope you found this episode educational, enlightening. If you have an idea for a topic that you would like for me to discuss, please let me know. If you have an idea for a guest that you would like for me to talk to, please let me know that as well. Again, favorite salad dressing. Put your favorite salad dressing, enter to win the coffee mug. It's a good looking coffee mug. It's got a little symbol on there, podcast. It's pretty good stuff. New episodes of the Nursing Home Pews podcast come out every single Monday. And with that, folks, We'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.